Good morning, good afternoon, and good evening, everyone. My name is Andy Lewis, and on behalf of our chairperson, Neural, and the whole of the Singapore branch Exco team, I'd like to welcome you to this evening's webinar, Biorisk Management, Successes and Challenges in Biomedical Laboratories. Before we start, some housekeeping. Please remember that this webinar will be recorded. So if you're uncomfortable with this, please turn your cameras off or feel free to leave the session at any time. We will give the opportunity to ask questions, so please feel free to post the comments and questions in the chat section, and we will ask as many as possible towards the end of the webinar. Throughout the session, if you can please turn your cameras off if you get the opportunity to speak, and then please put your camera on. And we will be taking some photos towards the end of the session as a group photo. And again, if you'd like to be involved in that, please turn it on. The meeting will be locked after 15 to 20 minutes. And as a reminder, the mics again will be muted. So this evening's session, with the ongoing COVID-19 pandemic, it reminds us all that there is a need to be vigilant and prepared for the constant threat which is posed by infectious diseases. This is vital for biomedical and chemical laboratories to have a good biorisk management system. This evening's guest speaker is Dr. Scott Patlovich. Scott is the Assistant Vice President of Environmental Health and Safety at the University of Texas Health Science Center in Houston, and an instructor at the University of Texas School of Public Health. Scott holds a doctorate in public health in occupational and health sciences, concentrating on epidemiology and disease control. Scott also holds a master's in public health in occupational and environmental health sciences, which he achieved both from the University of Texas School of Public Health. Scott's also a certified industrial hygienist. Scott served as a safety manager at the Texas Biomedical Research Institute, which is the only privately operated biosafety level 4 laboratory in the United States. He also worked as a senior safety and health manager at the Office of Safety, Health and Environment for the National University of Singapore and set up their campus biosafety program. Please give a warm virtual welcome to Dr. Scott Patlovich. Scott, over to you.
Andy, thank you so much. Good morning, everyone. It is an absolute pleasure to be here with you today. I really appreciate the opportunity to come talk to you about one of my favorite topics in the health and safety world, which is biological safety. And a special thanks to Alvin Gann for the invitation to come and speak with you today. I'm going to load up my presentation here in a moment, but I did want to say that I welcome throughout the presentation any questions that you might have. If you want to drop something into the chat, or if you just simply want to jump on screen and interrupt me, I'm happy to have a conversation about anything that I'm talking about here. And while I'm covering the topic of biorisk management, and we speak about some of the things related to the discipline of biosafety and biosecurity, please let me know if I breeze through something that you'd like a little bit more information about. I understand that many of you may not be necessarily all that familiar with biosafety, so I'll do my best to kind of introduce some of the topics or talk about some of the basic things related to the discipline as you see fit. I don't want to bore anybody either, so if it's too basic, tell me to move on. You're not going to hurt my feelings whatsoever. But again, it is an absolute pleasure to be here with you today. First things first, here in Texas, we say howdy. So howdy from Texas. The COVID-19 situation has gotten a bit dismal here with this so-called fourth wave. And so this is how we have to walk around. No, I'm just joking. That's a total joke. The fourth wave has not been kind to us here. That's not a joke, but we don't walk around like what you see here every day in our community. This happens to be a photograph from my previous experience that Andy just mentioned at the Texas Biomedical Research Institute in San Antonio with the biosafety level 4 or maximum containment facility that is designed and operated to handle and conduct research with the world's deadliest pathogens. So this includes all of the viral hemorrhagic fever viruses such as Ebola and Lassa fever virus and Marburg in Crimean Congo, and the influenza virus of 1918 that caused the Spanish flu, and lots of other pathogens that you don't really have any interest in being exposed to. And so there's a series of controls, engineering controls, administrative controls, and then of course personal protective equipment that are implemented into these maximum containment facilities that are critically important to protect the personnel working inside, as well as anybody outside of the laboratory as well, because we don't want these pathogens to be released to the environment and potentially transmitted to others. And so this biorisk management presentation is going to highlight the controls that we have put in here in Houston at the UT Health Science Center, where I work now, for working with SARS-CoV-2 virus. So I wanted to explain to you all some of the behind the scenes things that go on in a research lab to accommodate this type of research with a novel emerging pathogen, to make sure people are doing this as safely as possible. So again, this was over in San Antonio, which is about a 3-hour drive from Houston, where I used to work. We do not have one of these maximum containment BSL-4 facilities here in Houston. There's only a few of them located throughout the United States and throughout the world. This is the Texas Medical Center here in Houston, where I currently work. So the foreground is the Texas Medical Center. It's the world's largest medical center. Between all of the different institutions, all the different hospitals, universities, et cetera, collectively, there are about 10 million patient encounters that occur within the Texas Medical Center every year. And it represents the 8th largest business district in the entire country. So the background is downtown Houston. The foreground is the Texas Medical Center, and they're often confused because the conglomeration of all of the different buildings and institutions within the Texas Medical Center is really remarkable. And we get people literally from around the world who come here for healthcare because of the different organizations that exist, such as MD Anderson Cancer Center, Baylor College of Medicine, Methodist Hospital, Memorial Hermann Hospital, and so forth and so on. It's really quite an impressive place to work from the perspective of the resources that we have. If we don't have something, we can find a neighbor who usually does. And if we're looking for an expert in some form or fashion of research or healthcare, usually one of our neighbors has that expertise if we don't have it ourselves. So I've been lucky enough to work here in the Texas Medical Center for almost 21 years now at this point in time, with the exception of my time over in San Antonio and over in Singapore, which was really quite remarkable. These are some photos from my Singapore experience, because I know many of you, or perhaps most of you in the audience today are over in Singapore. I was there from 2009 through 2011 and had an absolutely remarkable experience working at the National University of Singapore in the Office of Safety, Health, and Environment, primarily to help with their biosafety program. We helped to make some improvements in biosafety across the university. And ultimately, one of the key accomplishments was the achievement of getting what's called ALAC accreditation. This is a gold standard accreditation for animal care and use programs in any research facilities around the world. So really proud to help the university achieve that status for the high quality and humane care and use program that they have there. And if you don't recognize me in any of these photos, I know I'm the Angmo here in these different photos from around Singapore, and really proud of my time there and the colleagues that I got to work with and interact with while at NUS. And by the way, I lived in Jurong East with my wife. It was a fantastic experience. Okay, so a few biorisk management challenges that I think just about everyone may have been dealing with around the world when it comes to the research setting. But I'll tell you about our experience here at the University of Texas Health Science Center here in Houston. with the onset of the global pandemic with SARS-CoV-2 and COVID-19 circulating around the globe, we had at first such a limited knowledge of the actual pathogen itself. We were learning by the millisecond more and more about how this pathogen was causing disease in humans and being transmitted to one another. And there was an absolute urgent need for research to understand about the pathogen, to develop therapeutics, and of course, ultimately to develop a vaccine against this pathogen. And so here in the United States, and I know many other countries around the world, were frantically setting up infrastructure to support this type of research, including making emergency funding available. And a lot of that funding came to fruition here in the United States, which is absolutely fantastic. The problem for us was that every interested researcher who had the energy and interest in the pathogen wanted to start conducting research with SARS-CoV-2, including a lot of non-virologists. This represents a risk to those individuals who may not be well versed in handling these types of pathogens in a laboratory setting. And so there was a great fear that, if not done correctly, we could have what's called laboratory associated infection events, where somebody who is working with a pathogen inadvertently exposes themselves, whether it be through a needle sticks or other contaminated sharps injury, or through the transmission through an aerosol, like if they spill something outside of containment, or they, as part of their research, are generating aerosols and accidentally inhale those or allow those aerosols to escape the lab. I mean, there's all sorts of different ways that you can be exposed to different pathogens. And so anyways, we wanted to make sure that this was done as appropriately as possible and as safely as possible to make sure that anyone conducting SARS-CoV-2 research was appropriately trained and that the facilities were appropriate for that work. So the capacity of the organization to accommodate research at the necessary safety level was exactly part of our job as the health and safety professionals at UT Health. What did this mean for us here at our organization? In a very short amount of time, we needed to build our biorisk management capacity surrounding this particular novel organism. We needed to evaluate risk within our laboratory setting and our clinical setting, and that included the collection, handling, storage, and research with both patient samples that may be from COVID-positive patients, or the isolated, concentrated virus itself, SARS-CoV-2 as it's known. And so evaluating our space, evaluating proposed research protocols, which had to do with either patient samples or the virus itself, doing so in an expedited fashion because we were receiving an extraordinary number of submissions to our institutional biosafety committee, the committee that's charged with reviewing and approving any research-related work with any pathogens or recombinant or synthetic nucleic acid materials. And so we had to set up the infrastructure for that committee to take on a significantly higher volume of protocol submissions. We needed to determine what laboratory space existed on our campus, hopefully vacant real estate that we could accommodate this type of work. Or if it wasn't vacant, where could we do this as safely as possible where other work may be already conducted. And then of course, we wanted to make sure that any personnel, whether it was the principal investigators or any of the laboratory managers or research staff or students for that matter, involved in conducting any research or related research was appropriately trained and demonstrated competency to conduct this type of work. And of course, our ultimate goal was to execute this research as safely as possible to avoid any of those so-called laboratory-associated infection events. What were some of the successes? I'll jump right into it for our institution. First things first, we have trained personnel in the discipline of biosafety and biosecurity on staff within our environmental health and safety departments. We've got a fantastic team with a lot of people who have a lot of bench experience, If you know anything about biosafety or know any biosafety professionals, oftentimes they come from the research laboratory setting. They learn about safety during the course of their work activities, and they ultimately school themselves up to be biosafety professionals. But anyways, the point being that our team was able to stay abreast of the ongoing pandemic situation, starting all the way back from in December of 2019, when cases were first starting to emerge out of China, to make sure we understood what the impacts were potentially going to be on us here in the United States and us locally within Texas and in Houston. And of course, as the pandemic developed and the opportunity for bringing these pathogens or this pathogen into our facilities was something that we stayed very attuned to. We wanted to make sure that our research staff was knowledgeable, as I mentioned, and thank goodness, I think everybody had utmost respect for COVID-19 and the SARS-CoV-2 virus, in that we had very responsible research staff who were willing for us to work together to conduct that detailed risk assessment of any proposed work with the pathogen. So we worked hand in hand with our researchers to develop the safe work protocols, to determine the appropriate safe work facilities, and that absolutely needed to be a partnership with our biosafety professionals and our research teams. Our leadership was really, they deserve a lot of credit, because they were the ones who helped to provide space and dedicate space for what's known as biosafety level 2 containment. I'll talk to you guys a little bit more about biosafety levels just to make sure everybody's on the same page about those here in a moment, because I've used this terminology a lot already. But biosafety level 2 containment with enhanced precautions, safety precautions for when patient samples from COVID positive patients were being used. And then biosafety level 3 space for any work with the isolated virus itself. Our institutional biosafety committee, which normally meets one time per month, the second Thursday of every month at 3 o'clock in the afternoon. That's the standing schedule they always have. They decided they would increase that frequency to twice per month during this surge capacity need for the extremely high volume of protocols we were receiving. So the committee was able to accommodate the review, and our membership really worked their tails off to review these protocols in fine detail to ensure all of the safety measures were in place. We had complete separation of work within our biosafety level 3 facility, which ultimately, as I'm going to show you a virtual tour in a few moments, our BSL-3 laboratory facility was not vacant at the time. And we had to make sure that if we were going to commingle SARS-CoV-2 and the current pathogen used in this space, which happened to be Mycobacterium tuberculosis, the bacteria that causes the diseased tuberculosis, that it could be done safely with both pathogens being stored and used in the same containment space. And then, of course, we had to make sure that additional specialized in-person training was developed and implemented for all personnel handling the SARS-CoV-2 virus, and also to ensure that they were competent and proficient prior to starting work with any infectious virus. That sounds a lot easier than it is to actually implement, by the way, in terms of all the training and careful oversight inside that containment laboratory. Now, here in the United States, these are the applicable guidelines and regulations that we have to follow. I'll give a few sidebars for other things that you probably have considered or should consider if you are ever involved with this type of work in Singapore or other parts of the world. But here in the US, the Centers for Disease Control and Prevention put out what was known as the Interim Laboratory Biosafety Guidelines for handling and processing specimens associated with COVID-19. And so the CDC put out these guidelines that essentially said, here's what you should do to protect yourself when handling patient samples or the virus itself. And the recommendation is exactly what I showed on the previous slide. Patient samples, biosafety level 2, and any isolated virus, biosafety level 3 containment. The Biosafety and Microbiological and Biomedical Laboratories document, so-called the BMBL, this I often refer to as the Bible of biosafety. It's currently on its 6th edition, which was released this past year. If you're not familiar with the BMBL, you can Google this one up. You can get it for free. It's a PDF through the CDC here in the US, and it describes and defines biosafety levels. So this is where I wanted to pause for a minute and just make sure everybody was on the same page about the terminology that I've been using. Biosafety levels are the containment levels that incorporate the practices, procedures, and facility design considerations for safely working with and containing any work with pathogens. So there are 4 levels: biosafety level 1 through level 4, with level 1 being the least level of containment, level 4 being the maximum level of containment. Biosafety level 1 laboratories are those that work with organisms that typically do not cause disease in normal, healthy humans. Although if you had somebody who might be immunocompromised or otherwise susceptible to a specific bacteria or virus that you need to be careful, of course. A biosafety level 2 laboratory works with pathogens that are infectious to normal, healthy humans. But usually biosafety level 2 laboratories accommodate work with pathogens that usually have a vaccine available for it, or there's therapeutics available for the disease. A biosafety level 3 laboratory also works with human pathogens, but usually those pathogens have some unique potential for exposure, whether it's aerosol transmission or if it's a novel pathogen. Usually the work with those novel pathogens are upgraded to the higher safety requirements to ensure that the people inside the lab are safe, as well as to ensure that nothing gets out of that laboratory. And then a biosafety level 4 or maximum containment facility is where work with imminently dangerous pathogens are used. And usually those imminently dangerous pathogens have no vaccine preventative measures. They typically may not have any therapeutic measures either. So thus the reason for the highest level of containment with those biosafety level 4 labs. The BMBL document defines all these. If you have any trouble sleeping at night and you want some light reading before bed, go ahead and read the BMBL. You'll be able to fall asleep pretty quickly, unless you're genuinely interested in the discipline of biosafety. But all of the details of the safe work practices and the facility design considerations for the different biosafety levels is defined in the BMBL. The NIH guidelines here in the US apply to the use of recombinant or synthetic nucleic acid molecules. So if we wind up manipulating the virus in any way that more or less wouldn't occur otherwise naturally, then the NIH guidelines apply. These were put into place primarily to make sure that researchers were not creating superbugs, allowing any antibiotic resistance that wouldn't otherwise naturally occur for different pathogens, that wouldn't allow pathogens to confer toxins that would not otherwise normally be found in that pathogen. So anyways, we were trying to avoid the creation of superbugs more or less with these NIH guidelines. And so we have to follow these here in the US for this type of work that qualifies. When it comes to designing our lab space, the NIH also has a laboratory design manual that's quite handy. Technically speaking, the NIH laboratories have to follow these. We don't have to, but we use it as a gold standard or best practice when we're setting up our laboratories from a safety perspective. And then I have starred here the US federal select agent regulations. So SARS-CoV-2 is not currently a select agent. SARS-1, as I call it, is a select agent. What does that mean? It means here in this country, and I know there's similar regulations around the world, including BATA, the Biological Agents and Toxins Act over in Singapore, that list specific agents that not only have a bona fide research potential, but could be, if gotten into nefarious hands, could be weaponized. And so select agents have a safety component and a security component that need to be in place for their use. Because SARS-1 is no longer circulating around the world, it is now considered a select agent because we don't want to release it back to the environment and start spreading SARS-1 again. SARS-CoV-2 obviously is readily circulating among the population around the world. It is not yet listed as a select agent here in this country. My prediction is that once we eradicate this disease, COVID-19, off the face of the earth, which I'm hopeful still, that it will become a select agent. So only time will tell there, but we do need to consider select agent regulations for going forward. If you're not familiar with the BMBL, again, please Google this up. Take some time to leaf through it on your own time. It's a very good document. Biosafety experts from around the United States and some international contributors put this together. The 6th edition just came out, so it's really smart and applicable to biological research as we conduct it these days. And I use this document all the time. This is a guidance document here in the US. However, if you are working with select agents or toxins, the federal rules say you have to follow the BMBL. So I call it a bit of a de facto regulation here in the US at least. Now, if you flip open the BMBL and you want to find out about biosafety levels and you don't have insomnia like I mentioned before, you can go to a little cheat sheet table in the BMBL, which is listed as table 1. It's a summary of the biosafety levels. This gives you the shortened version of those special practices, safe work practices, the procedures and expected facilities and containment devices that the different biosafety levels would dictate. And so this is a really handy little table to look at if you're interested in knowing more about the biosafety levels in a snapshot. Now, knowing that SARS-CoV-2 work requires biosafety level 3 containment according to our CDC interim guidelines that were released, we would go to the BMBL, we would look up biosafety level 3 requirements. In this case, it's just a snapshot on this table, but I could flip to the section on biosafety level 3 criteria and learn lots more. But more or less, the BMBL is saying that for any indigenous or exotic agents, which may cause serious or potentially lethal disease, especially those that are transmitted through aerosols, for example, those through the inhalation route of exposure, require BSL-3 containment. That's consistent with what's required now for SARS-CoV-2 here in this country. We need to make sure that our laboratory facilities and our practices and procedures, including personal protective equipment, is all designed and implemented, and people are trained on these features accordingly for these specialized facilities. So I'm going to go ahead and give you a little glimpse inside of our biosafety level 3 lab here in Houston in our facilities, because I'm not so sure that everybody in the audience has been in one of these laboratories, and I thought this would just be a unique opportunity to share with you guys what it looks like inside. So we currently operate 5 biosafety level 3 facilities at the UT Health here in Houston. Actually, 4 of them are here in Houston. One of them is at our satellite campus in the southern part of Texas in a town called Brownsville. But our biosafety team, who all work for me, we help to oversee safety within these spaces. Under normal circumstances in our biosafety level 2 laboratories across our campus, and we have, by the way, about 800 biosafety level 2 laboratories across our campus. We visit each of those laboratories once per year. Our biosafety level 3 labs, once per month, because safety is so important in those spaces. Our people who are biosafety experts go in there independently and evaluate safety in those spaces and ensure that the safe work protocols that are approved by our institutional biosafety committee are being undertaken within those spaces. So we decided that this particular laboratory was appropriate for considering the use of SARS-CoV-2. But as I told you before, Mycobacterium tuberculosis is already used in that space. So from a safety oversight perspective, we had to go in and conduct a risk assessment. As I mentioned, we did this in partnership with our research team to understand the space, the work activities that were being proposed, the current Mycobacterium tuberculosis work, and the proposed SARS-CoV-2 work to make sure that it was going to be done safely. We developed a biosafety protocol together. We submitted it to the Institutional Biosafety Committee for review and approval. That faculty-led committee, who has expertise in infectious disease research, was able to say, yep, you're following what the BMBL and the NIH guidelines say. We bless this going forward. And then once that happened, we had to make sure that we had a robust occupational health program to ensure that all individuals working in this BSL-3 space are fit for duty, that they have medical clearance for the respiratory protection program, because they do have to wear respirators inside the laboratory. They have to get immunizations, although there's no, at the time when we started this, there was no COVID-19 vaccine available. But other vaccines, basic vaccines for bloodborne pathogens and things like that are certainly expected for our staff. And then if anybody were to have an exposure event, despite the best training and safe work practices, we need to have a post-exposure evaluation process. The specialized training we implemented in a short amount of time, thanks to our researchers and our biosafety professionals. So we ensured that everybody had both initial training, and we're going to do ongoing annual refresher training for those folks. And as I mentioned, our staff, our biosafety experts, are in this space once per month conducting a documented safety survey. We also have security features in place limiting access to this facility and the agents themselves, because we don't want just anybody walking into the space. We don't want untrained individuals. We don't want anybody with nefarious purpose to go in there and try to steal pathogen. That could be bad. Of course, we have a robust incident response and emergency response plan in place. So if we have a spill inside the lab, or the building itself has a fire alarm, or maybe we get a hurricane that comes through Houston, which happens usually once or twice a year, what are all the things that we do to respond to those types of emergencies? That's all written down. Our anticipated perils are in our plan, and we have all of our response things in place. Of course, we have security plans in place as well, in cooperation with our police force on campus. We also check all of the fire and life safety features of this laboratory on a regular basis, everything from fire extinguishers to the emergency alarm, so the strobes, and also the alarm sound, to make sure that if somebody were working in the lab, they would know if there was an emergency in the building. And then we have what's called an annual laboratory commissioning program. So when we set this laboratory up, we have to shut it down once per year to make sure that all the equipment is working properly, the HVAC system is working properly, all of the containment devices are certified, the autoclave that decontaminates all the waste coming out of the facility is working properly and properly sterilizes all that waste. All of these things are done during the annual commissioning to ensure that the laboratory is functioning as designed. And this is a requirement, by the way, of the BMBL. I'm going to pause here for a minute because I'm remiss I told you on a few slides ago as I was going through the BMBL and the NIH guidelines that I'd mentioned a few other things. I did mention BATA, but for our other non-Singaporean participants, please check your local guidelines and regulations. The World Health Organization also has a laboratory biosafety manual that is somewhat equivalent to the BMBL document. I would imagine most of your countries reference the World Health Organization Laboratory Biosafety Manual. Some other countries have their own BMBL equivalents, so please check on those for your local countries and any applicable regulations specific to the pathogens that might be involved in any research. But again, in Singapore, it's going to be the Biological Agents and Toxins Act that the Ministry of Health helps to promulgate. Okay, back to this slide. I'm going to give you a glimpse into this particular BSL-3 laboratory. You do see at the top /ABSL-3. What that means is Animal Biosafety Level 3. The criteria for biosafety levels also incorporates when research animals are involved, because when you incorporate the use of research animals, you may be enhancing risk based on when animals are experimentally infected with a pathogen. What if an animal escapes? What if an animal bites you? What if you get a needle stick when you're handling an animal and it squirms around? These are all things that need to be considered. I'm going to take you through the different features of the BSL-3 facility where we have our SARS-CoV-2 work going over the next couple of slides. Diagrammatically, this is what the laboratory looks like. Not too complex. They have a clean hallway where personnel can walk in and out of the area. The anteroom is where all of the personal protective equipment is located. You have to badge in to get into this space, badge and key, I should say, to get into the anteroom. So only trained personnel are allowed in. And then once you get all your personal protective equipment, you would enter into the BSL-3 facility itself. And then there's an entry door into the ABSL-3, or the space that all of the research mice in this particular case are housed in and manipulated in. And then there's a pass-through autoclave built into the facility. So all of the dirty contaminated waste goes out of the facility through the autoclave, everything gets decontaminated and then brought out on the clean side, which is inside the anteroom after a validated cycle is completed through that autoclave. So that's a pretty simple how this works. In the back is a mechanical chase where the HVAC system is located and other services, electricity, plumbing, et cetera, for the facility. Highlighted in yellow are 2 hands-free sinks that can be operated by a foot pedal for in the anteroom and inside the laboratory itself. This is what it actually looks like from the clean hallway looking into the anteroom. We've got hazard communication signage in place, emergency call now numbers so that if something were to happen in the middle of the night, we could contact our researchers as well as our animal care and use staff. We've got a very fancy so-called ping pong ball on the wall, which shows you the directional airflow, which is from the clean hallway into the anteroom, into the BSL-3 space, into the ABSL-3 space, and then exhausted through HEPA filtration out of the facility. You would walk into the anteroom. Please excuse the photos. This is during our annual commissioning. We had some construction activities going on. It's not normally this dirty or dusty, but these are staged pictures during the shutdown. There are magnehelic gauges on the wall that show the air pressure differentials so that our staff can verify that negative airflow is in place before they enter in. All the personal protective equipment is located on the shelf that you see here. They would put all this stuff on or don it prior to going into the secondary door, which is interlocked to the main entry door so that both doors cannot be opened at the same time. Once inside the anteroom, the clean side of the autoclave has some signage here on autoclave guidelines and some magnet labels that you can put onto the autoclave to communicate what's going on with the contents inside. There's a picture of the hands-free sink inside of the anteroom, and this is a picture of that pass-through autoclave. On the left is the clean side in the anteroom. On the right is the so-called dirty side that everything is fed into the autoclave inside of that ABSL-3 space. Looking at the entrance to the laboratory from the anteroom, there is a pictorial here that reminds all staff of all required personal protective equipment. They should know exactly what they need to get into the space, but we always put a pictorial there so everybody is reminded so they don't forget. There's a manual login. We go old school here and have people sign in to the space, just put their signature, time in, time out. And then there's a ball on the wall to show the differential pressure from anteroom to main lab. This is what it looks like in the main lab. It's not exactly very spacious. There's some desktop space, the storage, refrigerator, and freezer, hands-free sink inside the lab, and then 2 biosafety cabinets that provide containment and HEPA filtration for any infectious work. This is what those 2 biosafety cabinets look like. If you're not familiar with biosafety cabinets, I can take a little time at the end to explain a little bit more about those containment devices, but all infectious work is done inside of those. Then we've got some centrifuges and some additional freezers and incubators around the corner. This is looking into the ABSL-3 space. You would enter through this door, and this is what it looks like inside. The picture on the left has 2 freezers. The center picture is a nebulizer, so you can actually place research animals into a little basket down into this sealed, gasketed, covered piece of equipment. You can actually nebulize Mycobacterium tuberculosis, SARS-CoV-2 into that chamber and allow the research animals to breathe in those pathogens as part of the experimental infection process. And then on the right, 2 additional biosafety cabinets for manipulating any animal cages with infected animals in that space. These are the individually ventilated cage racks that are HEPA filtered and exhausted, no air recirculation whatsoever. Each of these little rack spaces would have individual cages when animals are actually in that space. Back in the mechanical chase, these are the HEPA filters. We've got a pre-filter and the actual HEPA filters themselves that all of the air exhausted out of that laboratory space goes through prior to exhaust out of the building, no recirculation whatsoever to any other part of the building to ensure single pass, 100% exhaust air. Here in Houston, it's hot and humid for a good part of the year. And so that costs a lot of money, but it's very, very important to do as part of the lab containment feature. I'm going to switch gears really quickly here before I get to the end of the presentation and answer some questions. I am a member and currently on the Leadership Council for the American Biological Safety Association. If you're interested in the topic of biosafety, I've given you some of those references that you can read. But ABSA International has lots of good information on their webpage, absa.org, and I would encourage you to browse through their website to find out lots more about the biosafety and biosecurity disciplines. There are affiliate chapters all over the world for ABSA, including the Biorisk Association of Singapore, which I know is very active and has lots of good members. So you could rely on colleagues locally for information. And EBSA, it was the European Association, and ABSANS down in Australia and New Zealand there. So some resources for some of our folks who are participating on the call or the presentation today. ABSA has an annual biosafety conference. We just decided to go fully virtual for this conference, so anybody around the world could potentially participate. Doing this in person with the fourth wave uptick in cases with COVID-19 just doesn't make sense. Applied Biosafety is the journal of the association. I happen to be one of the associate editors at Current. It's a very good journal that has lots of great timely information about biosafety, best practices, lessons learned, case studies, et cetera. But importantly, we've been featuring a lot about SARS-CoV-2 and COVID-19 in the last couple of issues. So check out Applied Biosafety if you're interested. And I'm going to conclude with some iconic, very unique pictures from my personal experience here at the University of Texas Health Science Center during the last 18 months of COVID-19. This has been the most exciting, excruciating, and utterly exhausting time period in my career as a health and safety professional, and I'm sure for all of you as well. We've been impacted both professionally and personally. It doesn't matter where you are in the world. COVID-19 has been unbelievable with this pandemic. And so these last couple pictures I just wanted to show, they're important to me. They're somewhat iconic to me, and I figured you guys would enjoy seeing them. And it's just kind of shifting gears from everything I've been talking about with the research laboratories that we support and biorisk management, but they're certainly related. First picture is right at the onset of the pandemic. You can see in the picture on the right, less than 25,000 total cases around the world at this time. This was in early February of 2020. Giving this presentation, these are the foremost health experts in the entire city of Houston. And what are we not doing? We're not masking, we're not social distancing. How times have changed. We were given a presentation on the best practices for protecting our healthcare workers as the first cases were emerging on the soil of the United States. And so we did this training without any protection for ourselves. Again, how times have changed. Because of the severe global supply shortages of personal protective equipment, we were forced to reprocess N95 respirators in our hospitals and clinics. These are single-use devices. Never in my wildest dreams would I ever imagine that we would have to reprocess and reuse these devices, but there was an emergency use authorization by the Centers for Disease Control and Prevention to do this. We used vaporized hydrogen peroxide in a contained facility within our hospital to reprocess these. It was an amazing event, lots of meritorious work by nurses to collect these units, sterilize them, and get them deployed back out on the floor for reuse. We have discontinued doing this because it is absolutely not a best practice. It was done out of sheer necessity to protect our frontline healthcare workers. We were even low on disinfectant spray and hand sanitizer, disinfectant wipes. And finally, the supply chain was re-engaged, and all of a sudden we had pallets after pallets after pallets of hand sanitizer, I'm sorry, not hand sanitizer, disinfectant wipes showing up. And so all of a sudden we were creating fire safety egress blockages in our building. So as a safety guy, I was so happy to see all this disinfectant wipe showing up, but I was like, guys, you're blocking all of our emergency egress for our building. So we've got to do something with these pallets. So it was kind of a catch-22 there. And then finally, our local liquor store here in Houston is called Specs. I would have never imagined this in my wildest dreams, but when you walk into Specs during our severe supply shortages, you could not find alcohol-based hand sanitizer anywhere. Our local distilleries started making it themselves. And from a hazard communication standpoint, I absolutely just cringed when I saw vodka bottles and other liquor bottles filled with alcohol-based hand sanitizer with these labels where I was like, somebody could drink this stuff, but it's hand sanitizer. And this was being sold at our local liquor stores. Unbelievable that we had to go through this situation. But I thought this was just really remarkable, this picture here. So anyways, just for fun, I wanted to show you guys that. That's all I've got here. I'm happy to open this up to questions, discussion, and feedback. Thank you guys so much for your time.
Thank you, Scott. That was really interesting and yeah, very, very eye-opening. So we have a number of questions. I will run through these and there's a couple of curly ones, so feel free to pass should you choose to. You mentioned the detailed risk assessment process that needed to be conducted. During this, were there any mishaps or exposures to the technicians or researchers? If there was, what was your emergency response protocol to those situations? And that's from our chairperson, Newell.
Perfect. Great question. This is really important. Having a plan in advance for any research activity that involves biological agents or hazardous chemicals or radioactive materials or radiation producing devices, having a plan in case something goes wrong, right? So we have not had any mishaps, thank goodness, to date, knock on wood, with our SARS-CoV-2 research. However, we have had laboratory accidents with other pathogens. And so each of those pathogens needs to be fully understood in terms of how it's transmitted in nature, how it's transmitted in the laboratory potentially. Is there a vaccine available? Is there therapeutics available? Who's going to treat them? Are you going to be able to bring them to a provider that actually knows how to treat that disease? So this was really important to get with our occupational health providers to ensure they know we're conducting SARS-CoV-2 research, and that if we were to send them over from one of our laboratories, that they knew what was going on. So that communication is important, and that occurs at the institutional biosafety committee level. There's a lot more to it than that, but that's the short answer there.
Awesome, thank you very much. The next question is from Michael. He said, what is your opinion on the way that some of the Chinese laboratories handled the COVID situation?
I don't want this to sound pompous in terms of my response, but the New York Times called me asking the same question.
Fair enough. No.
It is absolutely unknown. Do I think it happened? No. However, I think what is potentially plausible is that during the initial cases that occurred in China, that the patient care activities could have led to secondary infections of those healthcare workers, or secondary infections to the laboratory workers that were working up the patient samples, trying to determine and do the diagnostics on those samples. And then they could have subsequently transmitted to other people. But do I think that this was nefariously made in a laboratory and then intentionally spread around the world? No, I don't think so.
That's a great answer. Thank you very much.
Yeah.
Caleb asks, how do you dispose of the biological hazardous waste?
Yeah, great question. Everything goes out through autoclave. So essentially it's cooked through steam and heat. And so those are validated processes. We use a biological indicator, a non-pathogenic surrogate organism called Geobacillus styrothermophilus. Try to spell that one on your next spelling bee. That indicator organism is run through the cycle. And at the end, we know if that indicator organism doesn't change color, we didn't cook it properly and we got to recook that cycle. So everything goes out through the autoclave. Of course, we're using chemical disinfection inside the laboratory, 10% bleach. There's some commercial products that we use as well that are either bleach-based or quaternary ammonia-based. So we follow the manufacturer's instructions on the concentration and contact time for any cultures, media, things like that, and then it gets recooked on the way out through the autoclave. So we do it twice, more or less. If we don't go through an autoclave, it goes out through a third-party vendor that contains the waste, sends it off for autoclaving or incineration. But for our high and maximum containment laboratories, it's required that you go through the autoclave on site before it leaves the laboratory space.
Awesome, thank you. JC, he asks, what kind of training and controls exist for personnel who may be required to undertake maintenance and housekeeping within the facility?
Great, fantastic question. That's excellent. First of all, we don't let housekeeping in the lab. The housekeepers are the laboratory staff. So they clean up after themselves. There's only a few people allowed in that space. So it's one of those things where they have to look after each other. They actually go on a rotation to mop, to clean all the surfaces. And then for the facility staff who may need to go in there. They don't go in there unless we shut the lab down, or if there's something catastrophic, we'd have to stop research, shut it down, and let those researchers in. That's why we designed it so that mechanical space in the back of the lab, they can access most, although not all, of the mechanical things that they need to service that unit, so they don't have to go into the hot lab. If any of that plumbing or HVAC system outside the lab is considered to be contaminated, we decontaminate it before we allow any work.
Awesome, thank you very much. Stephen, our former chairperson, asks, is there any alert system to detect an escaped virus within the lab?
Great question. So the answer is yes, although it's a bit tricky. It's not, some commercial products exist now, which I am not in love with, and that's a whole nother conversation, probably over beer. But we require in our laboratories, our laboratory staff to do routine wipe tests to detect the presence of bacteria or virus, or we have prions in some of our labs, so that if somebody accidentally contaminates their gloves and then goes and touches that light switch or goes and touches that doorknob, that we hopefully are disinfecting those on a regular basis anyways. But if we don't disinfect properly, then those wipe tests say, hey, that's contaminated. So we do that with a regular process. The lab staff does it. We do it independently to double check them.
Awesome, thank you. Another question from former chairperson Darren. What are your thoughts on Dr. Fauci's advice to the government?
Dr. Fauci, I think, has done a remarkable job. I don't know if that guy has gotten a wink of sleep in the last 18 months. I don't know how he does it, but he has been as level-headed as I think any human being could possibly be, giving sound public health advice based on current knowledge of what's going on. He is under excruciating political pressure. I commend the guy for all that he does. I don't agree with 100% of everything that comes out of his mouth, but he does a absolute remarkable job. I got to listen to him live one time, because most of the time all of us see him in news snippets, right? 30-second sound bites. But I got to see a presentation of his that he did for us 6 months ago. And anyways, the funny part about it was the guy was eating lunch while he was talking to us, because he has no time, right? And I didn't blame him. Like, go ahead, man, go ahead and eat, get your energy for the rest of the day, because we're the least of your problems today.
Great, thank you. Alvin, a gentleman you may know, how did you get buy-in from frontline workers to reuse the sterilized N95 masks? It was
not my favorite day as a health and safety professional, having to deal with these severe supply shortages and resort to reusing single-use PPE. It goes against the professional code of ethics that I've signed off on, all the way to the top here in the federal government, the Centers for Disease Control, and even the Occupational Safety and Health Administration, OSHA, blessed this to occur. I think all of us were cringing. It was either do this or you're not protected, because we could not get any N95s or PAPRs or other respirators on the open market. They were literally exhausted by all the hospitals and research needs, and the general community was buying up all the stocks. So that whole supply chain issue was forecasted based on lessons learned from other outbreaks like the swine flu and H1N1, et cetera. But we missed the boat there. So anyways, we did a lot of education. We did this carefully. We had a team approach with our infection prevention and control professionals, biosafety professionals, faculty leadership, to get the buy-in and communicate what we were doing to ensure it was done safely. Where did it go wrong? The one thing that ruined the N95s, sorry, ladies, I don't mean to be mean, but it was makeup. We had to give out makeup wipes to all of our nurses and physicians who are female, who are wearing makeup, because the makeup was ruining the N95s and not allowing us to reprocess them. So everybody had to wipe off their makeup, then put their respirators on. And then with the gentleman, I had more heart-to-heart conversations about shaving beards than I've ever had in my life.
I shall cool my face. Dr. Scott, thank you very much. This has been absolutely fantastic. It's been really eye-opening. It highlights the fantastic work that people in your profession have been doing in the medical side, and how you've partnered with different types of parts of the business to drive positive outcomes in extremely challenging times. What I will now do is hand over to Alvin to present a small token of our appreciation. Alvin.
Thank you, Andy.
Thank you, Andy. Yeah, so thank you, Scott, for this wonderful presentation and sharing all these best practices, especially during COVID and the challenges faced by you. So as a token of appreciation on behalf of IOSH Singapore branch, I'm giving you this e-certificate. Nice. Thank you so much.
Alvin, thank you. This is really special to me. I really appreciate it. I hope this was helpful as you guys get involved with learning a little bit more about infectious diseases and different pathogens and the discipline of biosafety. If you want to send me an email or drop me a text or a phone call, I'm more than happy to answer questions or point you in the right direction for resources and information. This is really important stuff to me. And we're all dealing with this pandemic. So don't hesitate to let me know if you have questions. Happy to help from here forward.